What is osteoarthritis? OA. Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It is a degenerative joint disease that occurs when the protective cartilage that cushions the ends of your bones wears down over time. While it's often called a wear and tear disease, modern understanding shows it's a more complex process involving the entire joint, including the underlying bone and the joint lining, synovium, leading to inflammation, pain, and stiffness. What happens in a joint with OA? Cartilage breakdown. The smooth, slippery cartilage on the ends of bones becomes rough and thin. Eventually, it can wear away completely. Bone changes. Without the protective cartilage, bones may start to rub against each other. The body may try to repair this by growing bony lumps called osteophytes or bone spurs around the joint. Inflammation. The tissues within the joint can become inflamed, causing pain, swelling, and further damage. Commonly affected joints. OA can damage any joint, but the disorder most commonly affects joints in your knees, one of the most frequently affected weight-bearing joints. Hips, another major weight-bearing joint. Hands, can affect the base of the thumb, the top joint of the fingers, Heberden's nodes, and the middle joint of the fingers, Bouchard's nodes. Spine, often affects the neck, cervical spine, and lower back, lumbar spine. Symptoms of osteoarthritis. Symptoms often develop slowly and worsen over time. Key signs include pain. The affected joints may ache during or after movement. Stiffness, most noticeable upon waking up in the morning or after a period of inactivity. Morning stiffness from OA usually lasts less than 30 minutes. Tenderness. The joint may feel tender when you apply light pressure to or near it. Loss of flexibility. You may not be able to move your joint through its full range of motion. Grating sensation. You might feel a grating sensation or hear a popping or crackling sound, crepitus, when you use the joint. Swelling, caused by soft tissue inflammation around the joint. Bone spurs. These extra bits of bone, which feel like hard lumps, can form around the affected joint. Causes and risk factors. Several factors can increase your risk of developing OA. Age. The risk of OA increases with age. Gender. Women are more likely to develop OA, though it isn't clear why. Obesity. Excess body weight adds stress on weight-bearing joints like the hips and knees. Fat tissue also produces proteins that can cause harmful inflammation in and around your joints. Joint injuries. Injuries from accidents or sports, like a torn cartilage or ligament injury, can increase the risk of OA in that joint later in life. Repetitive stress. Jobs or sports that place repetitive stress on a particular joint can contribute to OA. Genetics. Some people inherit a tendency to develop osteoarthritis. Certain medical conditions. Having diabetes, other forms of arthritis like gout or rheumatoid arthritis, or certain metabolic disorders can increase your risk of OA. Diagnosis. A doctor can typically diagnose OA based on physical exam. The doctor will check the affected joint for tenderness, swelling, redness, and flexibility. Imaging tests. X-rays. While cartilage doesn't show up on X-rays, cartilage loss is revealed by a narrowing of the space between the bones in your joint. X-rays can also show bone spurs. MRI, or magnetic resonance imaging. An MRI can create detailed images of bone and soft tissues, including cartilage, providing a better picture in complex cases. Lab tests. Blood tests or analysis of joint fluid can help rule out other causes of joint pain, such as rheumatoid arthritis. Treatment and management. There is no cure for OA, but treatments can relieve pain, maintain joint movement, and slow the progression of the disease. Management focuses on a combination of approaches. 1. Lifestyle and home remedies. Exercise. Low-impact activities like swimming, Cycling and walking strengthen the muscles around your joints, providing better support and reducing pain. Stretching is also crucial for flexibility. Weight management. Losing even a small amount of weight can significantly reduce stress on your knees and hips. Fat tissue also produces proteins that can cause harmful inflammation in and around your joints. Heat and cold. Heating pads, warm baths, can soothe stiff joints and muscles. Cold packs can numb pain and reduce swelling after activity. Therapies. Physical therapy, PT. A physical therapist can create a personalized exercise program to strengthen muscles, increase flexibility, and reduce pain. Occupational therapy, OT. An occupational therapist can help you discover ways to do everyday tasks without putting extra stress on your painful joint. They may recommend assistive devices. Medications. Over-the-counter, OTCs. Acetaminophen, Tylenol, often the first choice for mild to moderate pain. Non-steroidal anti-inflammatory drugs, NSAIDs, medications like ibuprofen, Advil, Motrin, and naproxen sodium, Aleve, can reduce both pain and inflammation. Topical NSAIDs, gels, creams, are also effective with fewer side effects. Prescription medications. Stronger NSAIDs, prescription-strength versions, are available. Duloxetine, Cymbalta, an antidepressant that is also approved to treat chronic pain, including OA pain. Injections and procedures. Corticosteroid injections, these powerful anti-inflammatory injections into the joint, can provide pain relief that lasts for several weeks or months. Use is typically limited due to potential long-term side effects. Hyaluronic acid injections, also called viscosupplementation. These injections aim to add lubrication to the knee joint. Results are mixed. Surgery. If conservative treatments don't help, your doctor might suggest joint replacement or arthroplasty. The damaged joint surfaces are removed and replaced with plastic and metal parts. Hips and knees are the most commonly replaced joints. Distinguishing OA from rheumatoid arthritis. Feature: osteoarthritis, OA, rheumatoid arthritis, RA. Cause: mechanical wear and tear, degenerative. Autoimmune disease, body attacks its own joints. Joints affected, often asymmetrical, example, one knee but not the other. Usually symmetrical, example, both wrists, both knees. Morning stiffness, lasts less than 30 minutes, often lasts more than 30 minutes. Systemic symptoms, none, limited to the joint, can cause fatigue, fever, and affect organs. Onset, slow over many years, can be rapid over weeks or months. When to see a doctor? You should see a doctor if you have persistent joint pain or stiffness that interferes with your daily activities. Early diagnosis and management can help you maintain your quality of life and protect your joints from further damage. Disclaimer: this information is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.